Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Doc, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten, and I'm joined by Dr. Metcalf today. Doctor, how are you doing?
Good. Nice to meet you.
Nice to meet you, too. And we're here in the emergency room. Can you talk a little bit about what it is you do here at Columbus Community Hospital?
You know, as in most emergency rooms, we are really here just to take care of a full gamut of whatever might come in for emergency services. That can be something as simple as a common cold or influenza, or it could be major trauma, it could be septic shock, respiratory failure, pneumonia. So most emergency room physicians have to feel very comfortable with full spectrum of care.
Well, you talk about working in the emergency room here, a very nice facility here in Columbus. Can you talk about, I guess, kind of what it is like to work here in Columbus and the level of care you guys are able to provide?
Yeah, I've really been impressed here. I started working here for full-time in emergency medicine about 16 months ago.
Okay.
I had transitioned from working 20 years at Faith Regional there in Norfolk, Nebraska. And it's a very impressive emergency medicine program here. They expanded the facilities, I believe just a handful of years ago. It's really state-of-the-art, all up-to-date equipment. We have very experienced clinicians here. The average one's been here over 15 years, and so I'm really proud to be a part of their team.
Well, talking about being in the field that long, it's probably pretty crazy to see how everything has changed over the years. What are some of the newer things you're seeing that have really helped you guys with that care?
You know, probably a lot of what's changed. Medicine's always an evolution. There's always more state-of-the-art ways to treat things like shock or pneumonia or respiratory failure. Guidelines have changed for the acute management of stroke and heart attack, which we see most every day. And so it's really our job just to remain up to date with the most current therapies for these things that can be quite life-threatening.
Wow. Well, and before obviously you were able to start working in the field for this long of a time, you had to go through some education. What was your educational background?
Yeah, I went to my undergraduate training was at Oklahoma State University in Stillwater, Oklahoma. Then I did 4 years of medical school at the University of Oklahoma, OU. And then I did 5 years of residency. I'm boarded both in internal medicine and in pediatrics. I've done now 14 years of emergency medicine, and I did 8 years at Faith Regional in Norfolk, being the director of the hospital medicine service, which takes care of all the patients in the hospital. So all of my career has been in inpatient medicine. I've never done really outpatient clinic, and I just really enjoy the acute care setting.
Wow. And talking about enjoying acute care, what made you decide during that educational period, or where did you decide that you wanted to be an emergency room physician?
You know, oftentimes it happens during your residency training. During residency, you get exposed to, and especially actually in medical school, to different realms of care. And it's during that time that most budding, growing physicians determine what brings them most enjoyment. And I always just enjoy the acute care setting, not knowing what you're going to be taking care of, just the challenges that are there versus an outpatient medicine where it's a little bit more of a controlled environment.
Well, we've talked a little bit about the advances technologically in this field, but I know there's some other stuff that's important to you as well.
There is. You know, I think most patients who come in, they fully expect you to provide state-of-the-art care, what we call evidence-based medicine. Physicians are really bound to that commitment. But there's other realms of really excellent medical care, and one is really education. This is true regardless of what you do in medicine, but the public really requires us or needs us to be able to educate them on things that are true and things that aren't true, really dispelling wives' tales or treatments that really aren't options, and helping them to understand their disease process and feel more comfortable with what's going on with them. So education is huge, especially in the realm of taking care of children that have parents, you know, there with them. And secondly, I think a real lost art of medicine is just the art of communication. A lot of people, especially in the emergency room environment, come in and they have not only concerns about what's happening to them at the time, but they oftentimes have hidden fears and concerns about what that means, what are the possible outcomes. And if you don't draw those things out and make them feel comfortable and really practice excellent listening skills, oftentimes they won't share with you what's the greatest burden on their heart. And so I really try to draw the patients out and make sure I have good just relational connection with them, so that when they leave here, not only have they been cared for medically, but their questions have been answered and they feel some realm of comfort as to what's happening with them.
Dr. Metcalf, thank you for joining me.
Hey, you're very welcome.
Thank you guys for tuning in for another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten, for Dr. Metcalf. See you guys next time.